Hello and welcome to Nightline. I'm Raymond Goh. Here are our top stories. Malaysians allowed to withdraw 500 ringgit monthly from Employees' Provident Fund for 12 months. Extension of the Movement Control Order, NSC to decide soon. And Malaysia's death toll from COVID-19 rises to 14, with 212 new cases recorded. Good morning. In view of the hardship faced by the people due to the Movement Control Order, MCO, following the COVID-19 pandemic, the government will now allow Employees' Provident Fund EPF contributors aged below 55 to make withdrawals from Account 2. In making this announcement on Monday, Prime Minister Tan Sri Muhyiddin Yassin said that the initiative will cover some 12 million EPF contributors involving withdrawals amounting to about 40 billion ringgit.
Menerusi kemudahan ini, semua ahli KWSP yang berumur bawah 55 tahun boleh membuat pengeluaran wang simpanan dalam akaun 2 masing-masing tertakluk pada kadar maksimum RM500 sebulan untuk tempoh selama 12 bulan. Permohonan boleh dibuat bermula 1 April 2020. Nasihat saya pada anda semua yang akan menerima manfaat ini, gunakanlah wang ini sebaik mungkin. Beli barang-barang yang perlu sahaja dalam waktu yang agak sukar ini. Yang penting pastikan setiap hari ada makanan di atas meja untuk seisi keluarga.
The Prime Minister said that the decision was made at the Economic Action Council EAC's meeting on Monday, together with other key initiatives. The government also agreed to channel an additional 500 million ringgit to the Health Ministry to help fight the COVID-19 pandemic.
Untukkan ini antara lainnya akan digunakan untuk membiayai pembelian peralatan perubatan seperti ventilator dan juga peralatan di ICU, peralatan perlindungan diri PPE, tambahan bagi kekatangan perkhidmatan perubatan awam serta keperluan makmal untuk saringan COVID-19.
Tan Sri Muhyiddin added that the government has set aside 100 million ringgit for the Health Ministry to make 2,000 new appointments, especially nurses, on contractual basis in the fight against COVID-19.
100 juta ringgit juga disediakan kepada
Apart from the earlier said initiatives, Tan Sri Muhyiddin said the government is set to announce additional measures to ease the people's burden during the COVID-19 pandemic under an economic stimulus package and people's assistance on March 30th. He said the Finance Ministry is formulating comprehensive measures which will take into account the interests of people from all sections of the community.
Semuanya akan diberikan perhatian oleh kerajaan. InsyaAllah jika diizinkan oleh Allah Subhanahu Wa Taala, saya akan umumkan pakej ransangan ekonomi dan bantuan rakyat yang lebih komprehensif pada 30 hari bulan Mac 2020. Kesemua langkah yang bakal saya umumkan nanti akan mengambil kira usaha untuk mengukuhkan kedudukan keuangan negara kita dalam jangka masa sederhana, dan saya berharap dengan langkah-langkah yang akan diambil oleh kerajaan, kehidupan saudara-saudari akan lebih terjamin dan ekonomi negara kita juga akan kekal kukuh.
The Prime Minister added that the most important thing is for the people to come together in solidarity to face the COVID-19 crisis plaguing the nation. At the media conference, the Prime Minister was also asked whether there is a need to extend the current 2-week Movement Control Order, MCO. The Prime Minister said the decision depended on the level of compliance on MCO, which is at almost 90%.
Kalaulah kiranya data dan angka yang kita lihat kemudian ini lebih rendah daripada apa yang kita lihat pada waktu hari ini. Itu akan kita pantau, tetapi sebelum tempoh itu tamat pada 30, kalau tak silap saya, hari bulan Mac, Majlis Keselamatan Negara akan bersidang. Sama ada langkah yang telah diambil untuk tempoh 2 minggu itu memadai atau perlu kita lanjutkan untuk tempoh seminggu ataupun 2 minggu daripada tarikh tamatnya 30 hari bulan Mac yang akan datang. Ini akan kita kaji dan kita akan maklumkan.
The Prime Minister said police and the armed forces have been ordered to reprimand the people so that they quickly return home after buying their daily necessities or medical items. The government has previously announced the implementation of the MCO from March 18th to March 31st. Tan Sri Muhyiddin also said that about 10 million masks will be imported from China and will be distributed to all Malaysians who need it for free. The National Disaster Management Agency, NADMA, has been instructed to use its allocation provided by the government to fund this.
Kita harap usaha sebegitu akan dapat mereka atasi, dan kalau itu dapat dilaksanakan, pengeluaran kapasiti pengeluaran topping dalam negeri ini saya dimaklumkan lebih kurang 2 ataupun 3 juta keping setiap bulan. Kalau itu dapat diusahakan, maka saya fikir bekalan dalam negeri ini lebih daripada memadai.
The Prime Minister said at the moment the price for one mask is about RM1.18 each. He also stressed that there will be no export of masks from Malaysia as it is totally banned. The initiatives announced by the Prime Minister were welcomed by Bank Islam's chief economist, Dr. Muhammad Afzal Nizam Abdul Rashid. He pinpointed the EPF withdrawal measure, which would help ease the financial burden of Malaysians in the M40 and B40 groups.
Based on our back-of-envelope estimates, a total of 4.37 million members are deemed from the informal sector, i.e. those who used to be as salaried workers and they have resigned and they have now started their own business. Against such backdrop, their EPF balance can be withdrawn from the scheme. The way we see it, these measures would help to ease the financial burden among the mid and low income earners as well as the informal sector employees, especially during the enforcement of Movement Control Order or MCO.
Meanwhile, the EPF said contributors can register via email or regular mail starting April 1st for the i-Lestari withdrawal facility. Its Chief Executive Officer, Ali Zakri Alias, said for online registration, members can do so beginning May 1st. Payments, he added, will be made into the EPF members' respective bank accounts starting May. The EPF recommends that members register via online starting May 1st, as the process will be faster and more accurate, with applications taking only 3 days to process. Ali Zakri also cautioned EPF members not to fall for any scam and asked them to deal only with the EPF. The Yang di-Pertuan Agong Al-Sultan Abdullah Riayatuddin Al-Mustafa Billah Shah has expressed his sadness and concern over the news that several healthcare workers from the Health Ministry, MOH, and private healthcare facilities have been infected with COVID-19. Comptroller of the Royal Household of Istana Negara, Dato' Ahmad Fadil Shamsuddin, in a statement Monday, said Al-Sultan Abdullah was extremely concerned about the situation, as the healthcare workers were the frontliners who spent most of their time and energy to help contain the pandemic. The MOH has previously confirmed that 19 of its staff and 5 from the private healthcare facilities have been infected with the disease. 2 of the MOH staff are currently receiving treatment in the intensive care unit, ICU, and investigations found that all of them were close contacts to the first and second generations of the Tabligh clusters. As of March 22nd, a total of 460 MOH healthcare workers had been tested negative for COVID-19, while the remaining 190 were awaiting results. The number of new COVID-19 cases took a drastic jump when 212 new cases were detected nationwide, while 4 deaths linked to the coronavirus were recorded on Monday. The latest infections bring the tally of cases in the country to 1,518, while total deaths stood at 14.
Speaking at the Health Ministry's daily media conference on COVID-19, Health Director General Dato Dr. Nur Hisham Abdul Wasit of the figure 123 of the new cases were linked to the Tabligh cluster at the Seri Petaling Mosque. This is the highest number of new cases recorded in a day, with the previous record at 190 new cases on March 15th. Dato Dr. Nur Hisham said currently there were 57 cases that are being treated at the intensive care unit, with 27 requiring ventilators to aid with breathing. On the 11th fatality, Dato Dr. Nur Hisham said the 70-year-old man had a travel history abroad and was treated at the UKM Tuanku Muhriz Chancellor Hospital. The 12th victim was a 70-year-old Malaysian man linked to the Tabligh cluster and was treated at the Kluang Hospital. While the 13th victim was a 49-year-old Malaysian man who was the son of a woman who also died of COVID-19. He was treated at the Sarawak General Hospital. The 14th death case was a 51-year-old woman who was a close contact to a positive victim from the Tabligh cluster. Dr. Nur Hisham, however, added that 20 cases have recovered and allowed to be discharged, bringing the total of recovered cases to 159.
A COVID-19 recovering patient has come forward to tell his near-death experience in fighting the disease. In a video interview, 31-year-old Hamdan Hashmuddin, who is currently receiving treatment at the Rembau Hospital in Negeri Sembilan, shared his experience and urged the public to adhere to the Movement Control Order, MCO.
When I first got to know that I was positive, the ambulance rushed to my home, picked me up and brought me to Hospital Tuanku Jaafar Seremban. There, I was put in an isolation room, being monitored by the doctors 24/7. When I entered the first day, the doctor took X-ray inside the room, and they told me that half of my lung was infected, and I need to be treated immediately. And they gave me some antivirals medicines, which is the same that they use to treat SARS. The symptom that I had gone through at that point of time was I was having high fever and a dry cough, and it was very hard for me to take a deep breath. Once I tried to take a deep breath, I will start coughing like crazy, and there was because of the dry cough, there was nothing much to cough out, and it was very painful. It was excruciating. The treatment I received was excellent. The medicine worked very well for me. However, it took me 5 days to fully recover to a state where I can start breathing normal again. And once I have been stabilized, they transferred me to Hospital Rembau due to they need to focus on other patients who need more attention in Hospital Seremban. I hope that Malaysians out there, please stay at home, stay safe, keep your distance when you are out.
Malaysia's nationwide response can be a model for other countries to help flatten the curve of the COVID-19 pandemic. An associate professor of neurology at Washington University in Missouri, Jason Hassenstab, also praised Malaysia's response to the virus and suggested well-developed countries like the United States to emulate the measures.
Hassenstab, in his Twitter posting, said Malaysia's enforcement was evident across the country, including in a remote rainforest. He said mobile carriers could be seen sending out messages about social distancing every day. Hassan Stab gave a few other examples, noting the scenes at the Kuala Lumpur International Airport, KLIA, with security guards enforcing social distancing, which includes taping off seats to provide distance. He added that all airport employees were wearing face masks while hand sanitizers were at virtually every counter. Hassan Stab also compared KLIA with other busy airports, including at Atlanta, where he said only 5% of customs and border control personnel had masks and gloves, and businesses were as usual. Hassan Stab rounded off his series of tweets urging the US government to send consistent messages to flatten the curve and learn from Malaysia in combating the spread of the virus.
Media Prima Berhad is calling for urgent contribution from members of the public in an effort to fight the COVID-19 infection in the country. In this regard, the largest integrated media company in Malaysia has launched a campaign to collect funds for the COVID-19 humanitarian aid through the Media Prima NSTP Humanitarian Fund. Media Prima Group Chairman Datuk Syed Hussein Al-Junid said it is the country's responsibility to help create awareness and forward the latest breaking news as well as delivering humanitarian assistance. He added that Media Prima would work with relevant parties to channel the contribution and had already contacted hospitals and determined their urgent and critical needs. Members of the public can contribute to the fund by cheque, online banking or depositing directly to the account shown on your screen. The death toll from the COVID-19 outbreak in Italy has risen by 651 to 5,476. The figure is an increase of 13.5%, but down on Saturday's figure, where some 793 people died. The total number of cases in Italy rose to 59,138 from a previous 53,578, an increase of 10.4%. Local officials said the number is the lowest rise in percentage terms since the contagion came to light on February 21st. Of those originally infected nationwide, 7,024 had fully recovered on Sunday, compared to 6,072 the day before. The hardest-hit northern region of Lombardy remained in a critical situation, with 3,456 deaths and 27,206 cases. The United Arab Emirates have decided to suspend all inbound and outbound passenger flights and the transit of airline passengers in the country for 2 weeks as part of the precautionary measures taken to curb the spread of COVID-19. The decision, which is subject to reassessment, will take effect beginning March 25th. In a statement on Monday, the Civil Aviation Authority said cargo and emergency evacuation flights would be exempt. The UAE, whose international airports in Abu Dhabi and Dubai are major hubs, said additional examination and isolation arrangements will be taken later should flights resume in order to ensure the safety of passengers, air crews and airport personnel and their protection from infection risks. The authorities intensified its measures on Monday, shutting down public spaces and urging residents to stay at home amid the threat of legal action if the directives are violated. The country has so far confirmed 153 cases, with 38 recoveries and 2 deaths.
In Indonesia, the Health Ministry announced 65 new confirmed COVID-19 cases on Monday, bringing the total number of infections nationwide to 579. Local officials said one more person had died of the disease, bringing the death toll to 49. Singapore Airlines will cut capacity by 96%, ground almost all of its fleets, and look to raise funds in response to COVID-19 travel restrictions it called the greatest challenge it had ever faced. The move comes as the global travel hub closed borders to travelers and transiting passengers in a bid to stem the spread of the virus. Hong Kong authorities said on Monday it was stopping all tourist arrivals and transiting passengers at its airport and was considering suspending the sale of alcohol in some venues, joining cities around the world in the battle to halt the spread of the COVID-19. In announcing the tough new travel restrictions, Hong Kong leader Carrie Lam said the government was also planning to curb the sale of alcohol at more than 8,000 bars and restaurants in an extraordinary move in a city that never sleeps. McDonald's Corp would temporarily close all its restaurants in the United Kingdom and Ireland by Monday evening due to the coronavirus outbreak. In a statement, the company said it would also suspend share buybacks to help it navigate through the crisis, but has not changed its dividend policy.
Still to come on Nightline, mechanic first person charged over enforcement of movement control order. Stay tuned. Welcome back. Still on the local front, Petronas, through its corporate social responsibility arm, Yayasan Petronas, is contributing 20 million ringgit worth of medical equipment and supplies to help hospitals and healthcare frontliners mitigate the spread of the COVID-19 pandemic in Malaysia. Yayasan Petronas, in a statement, said the contribution will be carried out in stages in collaboration with the Health Ministry and the National Disaster Management Agency, NADMA. It added that the Ministry and NADMA will channel the critical medical equipment and supplies to gazetted hospitals for COVID-19 and quarantine centres. This include ventilators, hospital beds and mattresses, thermal imaging cameras, virus test kits, masks and personal protective equipment. Hand sanitizers will also be provided to senior citizens at selected homes. In Perak, a mechanic became the first person to be charged in connection with the movement control order for obstructing a public servant from discharging his duty in enforcing the 14-day order which took effect on March 18th. 33-year-old S. Punyamurthy pleaded guilty to the charge at the Sungai Siput Magistrates Court after it was read out before Magistrate Nur Hapsarina Ayub. He was fined 5,000 ringgit in default 10 months jail for the offence. The accused was charged with voluntarily obstructing a police officer from discharging his public functions by refusing to produce his personal identification document and pushing the police officer concerned in front of his house at Taman Orchid, Sungai Siput last Friday. The charge under Section 186 of the Penal Code provides an imprisonment of up to 2 years or maximum fine of 10,000 ringgit or both if found guilty. After the break, nearly two dozen killed in prison riot. More on this when we come back. On to the foreign front now. Panic over the spread of the COVID-19 has sparked a prison riot in Colombia that killed 23 inmates on Sunday while injuring 83 others. Local officials said rioting swept through the crowded jail overnight in Bogota as detainees protested unsanitary conditions in the penitentiary system amid the global outbreak. Justice Minister Margarita Cabello, however, described the violence as an attempted mass breakout, part of which she said was a coordinated plan with inmates who caused disturbances in 13 jails across the country. The minister rejected accusations by rights groups that the riots were sparked by unhygienic conditions inside a prison system that is woefully unprepared to face the pandemic. Colombia will begin a 19-day mandatory lockdown of its 48 million population on Tuesday to stem the COVID-19 infections. Turkish and Greek forces have fired tear gas on both sides of the border, where large groups of migrants have been waiting to cross into Europe. According to officials, Turkish police retaliated after Greek forces fired tear gas at migrants playing football on the border. There was no immediate comment from Greek authorities. Tens of thousands of migrants have been trying to enter Greece, a European Union member state, after Turkey said in February it would no longer keep them on its territory as part of a 2016 deal with Brussels in return for European Union aid. The EU has called on Turkey to stop the migrants from Afghanistan, Pakistan and Africa, as well as Syria, from crossing the border. Greece has been using tear gas and water cannons to stop the migrants, and both countries have sent troops or security forces to the border. Now, before we wrap up this edition of Nightline, let's take a quick look at what's been installed on the front pages of Malaysia's main newspapers for Tuesday, March 24th. The New Straits Times and Berita Harian both highlight the additional measures announced by the Prime Minister to lessen the burden of the people amid COVID-19 outbreak. While the nation's best-selling Malay newspaper, Harian Metro, focuses on the possibility of extending the movement control order. The Malaysian Reserve's lead story underlines the national airline sector, which is in dire need of government aid or face bankruptcy. Be among the first to get your copies today. Now, as we wrap up Nightline, let's take a look at Renault's Chinese test driver Guan Yu Zhou winning a virtual Bahrain Grand Prix as Formula One sought to entertain fans with esports action in a season stalled by the spreading coronavirus. With that, I'm Raymond Goh. Thank you for watching and for your company. Please stay safe and make sure you stay at home. Take care.